Assalamu alaikum wa rahmatullahi wa barakatuhu. May peace be upon you all. Welcome to your program once again, Healthy Check, a program where we strictly discuss health affairs. A program where you get free medical advice. And with me today are two dental specialists or public health dental officers. That means we are going to be discussing about dental systems and specifically toothaches. With me on my immediate right is Dr. Mogulo Shaban. You're most welcome.
Thank you, sir.
Next to him is the Dr. Chibugo Hamid, and it's not your first time coming to Health Check.
I'm glad to be hosted here again. Assalamu alaikum wa rahmatullah, dear viewers.
Wa alaikum salam wa rahmatullahi wa barakatuhu. Ladies and gentlemen, like I've just told you, in this program you're going to be getting free medical advice, and in today's program it is going to be strictly toothaches. Well, I want to ask a question to you doctors, how a toothache really pains. Most of you, I guess, have experienced so I won't imagine that if you have ever experienced how a toothache really pains, you'll need to ask a question, how it pains. I'm just gonna go straight to the question to my brother, Dr. Shaban. A question, sorry, Chibugo Hamid, if I'm not mistaken, a question of how these toothaches happen. How do they come about?
Thank you so much. As you've rightly brought it, we cannot explain how a tooth pains. Everyone, many of us have ever experienced it.
Exactly.
And toothache or tooth pain is the sole reason as to why very, very, very many people come to seek care.
Exactly.
And we have a notion that if at all I don't have pain, I'm not sick, which is wrong. So how does this problem that is affecting everyone come about?
Where does it start?
A body is wired by nerves.
Exactly.
So when these nerves are irritated, we have to get pain. Now, if at all we go to a tooth, specifically, the tooth has three parts. We have the outer layer, which is the enamel, the middle layer, which is the dentin, and the pulp. The pulp is composed of nerves and blood vessels.
Okay.
Now, in dentin, we have just some extensions of nerves. That's why when a damage to a tooth reaches the second layer, which is dentin, you start to feel some sensations, sensitivities. Now, when it reaches the pulp, for me I call it the heart of the tooth, that's where we experience the dental pain. So how does it happen? That when we talk, the term we use is pulpitis. We pulp from the word pulp, and ITS is inflammation. So inflammation is a body's defense mechanism, a natural. Whenever there is any harm to the body, to any part, we see that process happening. We see blood flow increasing in that area. By so doing, it swells, it gets reddened. Now, if at all you are bitten, maybe on the arm, the arm will extensively swell.
Exactly.
But now we are looking at the dental pulp that is surrounded by hard surfaces of enamel and dentin. Now, when it tries to bulge, remember the blood flow is increasing because the nerve has been affected. So when the blood flow increases inside the pulp, it swells up and pressure increases inside the pulp. Now, due to that increased pressure, in the brain, it will be sensed as pain.
Of course, the nerve is going to communicate to the brain.
It communicates that there is a problem here. So the increased pressure, it will be sensed as a pain. So that is how it comes. So whenever you have any tooth pain, there is always a factor that is causing pressure to increase. This pressure is as a result of increased blood flow within the pulp. When it does, of course, you get the pain.
Thanks a lot, Dr. Chibugo Hamid. I'm now turning to you, Dr. Shaban. How do these toothaches present?
Okay, thank you, Mr. Moderator. As you have already heard about how the tooth pain comes all about, we are going now to look at how these toothache present or their causes. We have got different origins of dental pain, which is toothache. We have got the prime cause of toothache, which is tooth decay. It is the most rampant cause of what? Of toothache. Then we have other causes where we have fractured teeth, we have impacted teeth. These are normally teeth that fail to erupt into the oral, into the mouth. Yes, so we have also gum diseases also can manifest as a toothache. We have got also fractures or broken restorations, maybe those fillings, cemented teeth, they may also fracture and also get what? Pain. Then also we have also what we call mechanical causes, whereby maybe you brush wrongly and you reduce on the size of your gum. We call it gum recession in our professional language. So that one also can elicit dental pain.
Okay. Thanks a lot, Dr. Shaban. Dr. Hamidu, please. In the beginning, you talked of how these toothaches come about, how they happen. Well, our viewer out there would like to know if you have anything that differs from what he has told us, the causes of these toothaches.
Of course, I cannot differ. I cannot differ. But before adding on the causes, let's see how it presents, because you also hinted about it. How does it really present? It presents in various ways.
Instead of talking for them on their behalf, why don't we have a word from our viewers, from the people that have experienced this pain before? I hope my production team have those pictures of such people that have experienced this pain, explaining to the doctors. Inshallah, if they have them, they will be playing them for us, inshallah, God willing, as we continue, please.
If at all you don't seek for care early enough, it can progress, and you get what we call necrosis or pulp death. Okay. So when the pulp dies off, you will start having an ache or pulsating pain. So that will show that the damage has gone out of the tooth, and now it is affecting the surrounding tooth structures. Okay. So it will be as if it's a pulsating pain. Okay. By the way, very many people say that, you know, in our localities, they call them worms. That is a worm that eats up a tooth. So it's very, very, very hard for us to explain to them that there is no worm or any insect that eats up a tooth. Okay. They will ask you, but really, even I feel it moving.
Moving inside. Dr. Hamid, I'm going to ask you to hold a little bit. The pictures are ready now, I guess. So let's have a look at some of our viewers out there explaining to us their experience meeting the doctors, how they feel. How do they experience these toothaches?
And actually, even here in Africa, we have the different types of toothpaste that we use, which are not so good on the market. Some are counterfeits. So once you use it, it will cause a tooth decay. And others, they are poor methods of cleaning your teeth. Some of us don't know how to clean our teeth well. If you get a toothbrush and you put a paste there, and then you just brush like once up and then down, and then you think you've brushed, and then you go away. Yes. And some of us sleep in the night when we've not brushed, and it's always advisable that before you go to sleep, You wash, you brush your teeth. After the meals, you brush your teeth, and then you proceed on to go and sleep. Some of them used to use like salt. They could put salt there to overcome the pain. Others could stop using that side where the tooth is, where they're having a decay from where the pain is. They don't use that side when they are eating. So you see even some people just stop, like he knows that if he puts there cold stuff, he feels pain, or hot stuff, feels pain. So he just stops using that part. Others could even use ash, because others are told that when you use ash, you reduce on the pain. Others use they use local herbs. There are those local herbs which people, the locals, know. So when you can find out from the experts that do look for the different herbs which can treat the teeth, you get some pain relief from that also.
Yeah, well and good. I've ever been affected by tooth diseases, and there are various symptoms where you can see someone with tooth diseases. First of all, there are those whose cheeks get to swallow, and there are those whose gums also become swollen. But according to me, I didn't experience any of those symptoms, but only that I only experienced the pain. And I try to use the local way of preventing this pain. Like I once used salt, as they told me. It's one of the major way of preventing the pains in a local way. And I also used ash to prevent, but all of these never reduced the pain. So I had to go to the hospital and see the dentist finally. The dentist removed my tooth, and now I'm well and good.
Well, you've heard from them, two of our viewers, different views or experiences. Yeah. Dr. Chibugo Hamid, the first man, is it right that toothaches can also cause tooth decays?
He has raised a number of points, but counterfeits, very many people blame the toothpaste they use, but I will not concur with him.
Okay.
Because toothache is basically physical. Okay? It's a physical process. Okay. What do I mean by physical? That we cannot blame the toothpastes we use, because toothpaste only helps in the prevention bit.
Okay.
So however much you brush with whatever toothpaste, be it cheap or expensive, you can still get a tooth decay.
Okay.
Yeah, you can get it. But the counterfeit, it's minimal. It's minimal. But very many patients, they normally blame the toothpaste. What the toothpaste can do, some people react on various toothpaste. If at all he had brought it in that way, okay, that someone can tell you that if at all I use Colgate, my teeth are so sensitive. There, your body is just reacting to that, or there is a component in the toothpaste that your body is reacting on. So what we do, we just advise you to switch to another, because we have very many Sensodyne, and close-up. So they have various types of toothpaste. So, but for the counterfeit, I have had it a lot, but it is at a lesser extent, because toothpaste, or what brushing doesn't, when you brush using toothpaste, it just prevents. As you know, prevention is better than cure. Exactly. But if at all a cavity has already formed, then you have nothing to do, even if you brush 100 times a day, because you cannot brush inside the hole. Oh. He talked of the gums swelling, he talked of the abscesses.
Yeah, okay.
Yeah. And that's where we were. That when you get a swollen cheek, this is pus forming. By the way, I normally tell it to my patients, and they get surprised. Really, I have pus, but whenever you see a swollen
actually
cheek,
just the pictures, thanks to my team.
So whenever that cheek is swelling, because the pulp died, and now the infection from inside the tooth is affecting the surrounding tissues.
Okay.
And there is pus formation around that area. So the cheek is swelling. Okay?
Okay.
So now, due to the swelling, it creates pressure. There are nerves that are, no, there are blood vessels that supply those regions. By the way, the mouth is the most vascularized. It's the part that has a lot of capillaries and blood vessels. So your pumping of the heart, you'll feel that it will be pulsating. Now someone translates it as a worm moving.
A worm moving within that.
I was on the presentation. Others, they will present, someone has a tooth up, tells you all my lower teeth are paining. Or they will point at a place where they removed the tooth, a tooth that was worked on. So referral of pain is normal, okay? And it's a normal presentation, okay? Or you can feel all the teeth at that side paining. Another thing, you can feel radiation, we term is at radiation, that the tooth might be hurting, but you feel headache, either on, most especially one-sided headache, and near the ear. Someone tell you, just around the ear here, and this part is paining so much. I don't know what's the cause. Now, when you check, you can easily find a tooth paining.
Jazakallah sanal jaza. Thanks a lot, Dr. Sahib. Esteemed viewer, from what I've learned from the doctor, one of our viewers out there that given us his view in the first place concerning the counterfeits of toothaches. What I've learned from what you've just explained is, though he did mention his name, sorry for that, is that no matter the type of the toothpaste, it's a matter of learning how to use it. Okay, thanks a lot. I now turn to you, Dr. Shaban. Well, he has explained almost each and everything concerning pain. And so this being Muslim television Ahmadiyya, Allah subhanahu wa ta'ala, through his prophet, told us that each and every kind of disease has a treatment, has a cure. But in most cases, we fail to find the true or the right treatment for a certain disease. I hope you have the right treatment for these toothaches. Do you have any?
Yes, we do, and we always advise people, whenever you have a toothache,
okay,
it's better to reach out to the dentist, because we have a lot that we can do to your toothache according to the cause.
Okay.
Because we are going to manage it according to the cause that is causing it.
According to the presentation,
yes,
I guess.
and yeah, the cause, the origin. If we find out that your toothache is due to tooth decay, then we are going to look at that tooth and we see what we can do for it.
Okay.
We can cement it. We seal up the what, the hole that is in it, such that there is no more infection that enters into it to cause the pain. And also we can also do what we call root canal treatment. When we talk about root canal treatment, we basically mean the removal of the nerves that are in the what? In the tooth. Then afterwards, there are very many procedures that we do in root canal treatment, but the essence is to denervate it, to remove those nerves that are inside there, the tooth. Then afterwards, we dry that tooth properly. Afterwards, we do what? We seal that what? That hole that is there. When we talk about root canal treatment, in most cases, some people may think, what do they do that it brings this tooth not to pain again? As I've told you, we denervate it, but we make that tooth insensitive. Yes, what I mean insensitive, this tooth is not going to be stimulated again to cause pain.
Okay.
The reason is, when those nerves are there, remember the tooth has to feed also, like the way we eat.
True.
So it gets its feeding through those those blood vessels that enter it. Then also, this sensitivity that we get that cause pain, they are due to the nerves that enter there. So now, when we remove all those nerves, we remove even the blood vessels, we make that tooth insensitive to any pain. So you can stay with your tooth when it doesn't pain you, but when it is in the mouth, it can help you
and you are using it.
It can help you to eat food. And also, what we also advise people after we have done that root canal treatment, if you can afford, it's better. You organize with your dentist. They make a crown for it.
Okay.
The crown is that we can organize it and put their crown. That crown is going to offer it more support.
Okay.
Because when we remove those, it's feeding. It will no longer be getting feeding, and it's going to be a little bit brittle, so it can easily fracture. Okay. So, but when we put that crown, it is going to be having a lot of support, and it can eat for very many years.
So the crown is going to protect it?
It is going to protect it.
Okay.
Yes.
Thanks a lot, Dr. Shaban. Dr. Hamid, I see you might have a few additions concerning the treatments. Do you have any?
Yeah. He has brought it right.
Okay.
That with it, very many our patients think, as you've said, even you think.
Yeah. Before I denied that method of treatment, of pulling out my teeth.
You've said whenever you go to the dentist, and one of the factors that's deterring you from visiting a dentist, you think they just remove.
They have to remove it.
So you've decided that other than going to the dentist, they remove my tooth. Let me rather stay
with my pain.
Let me tell you this. In dentistry, the earlier the better.
Okay.
But you don't have any pain. You go to the dentist. They will advise you on proper brushing.
Okay.
Now, if at all there is any tooth with a cavity, as has brought it, that is as deep as dentin, we shall just cement it. Okay. Because when it exceeds there, then we do a root canal. Okay. We remove the sensitive part. Okay? Now, he has also brought, now, just toothpaste is cheap. Now, when we come to cementing, it's more, it's
actually, that brings me to a question, Dr. Hamidu. There is a norm, there is a saying that prevention is better than cure. And I buy it. I buy that norm because it is sometimes costly going to a clinic for treatment. Sometimes it costs some of my brothers and sisters out there to losing their teeth. Okay, so that means it costs a lot when you think of treating your teeth or your dental system. I hereby ask you to give us some prevention measures that can prevent us, that can help us from getting tooth decays, toothaches, and the likes.
Good. So the prevention of tooth decay is about 3 things. 1, just make sure you care for that tooth properly. That means, this means that at all times there shouldn't be food left on your teeth. There you'll prevent decay, gum disease, and everything. So that's 1. 2, their strings we use, they are called dental flosses. They are used to clean in between teeth. Okay, so we advise people to also clean in between teeth with them. Another thing is regular visits to the dentist.
Okay.
Regular visits, because you don't know this. By the way, toothache comes at the terminal end. So if at all you do 2 visits per year,
okay,
that means we can identify these holes early enough. We can see that maybe you are not brushing well. We teach you. Okay, yeah. So brushing is also, I talked about it, but someone brushes in the morning, they eat breakfast, they add on lunch, they add on a snack, they add on supper, they brush again in the morning. When you come to me, you are not brushing. So when you talk of people who brush, okay, you should properly brush, okay? You should do it right. How? At least twice a day brushing. You brush in the morning. We advise after breakfast. People just they
take
brush.
Their breakfast.
They
brush before taking the breakfast.
Yes. After you've done a good job of cleaning the teeth, then you add on food. So you've washed and.
So it's better You brush after eating.
Good. You brush after eating. That's the right way. At night, as a must, you have to do it, and also train your kids to do so. The last work or duty to do should be brushing, because now you are at rest, everything is at rest, because now during day you are talking. So the microorganisms, they don't concentrate a lot. The acids produced don't concentrate a lot on our teeth. So if at all you don't brush at night, yet you've eaten supper, that means the acids will have much time to log in our teeth, and whenever they be in contact for a long time, the destruction will keep on happening. So to prevent that, sleep when you've removed everything.
So thanks a lot, Dr. Chibugu Hamid. I'm sorry, the matter of fact is we've never been good friends with time. Our esteemed viewer out there, I believe you know that time has never been our good and dependent ally. So I'm gonna have to stop you for today, and I hope inshallah next time you honor us a visit once again, just as you've done. And please, thanks a lot for honoring our invitation. I remain your host, Nambale Bashir, but before I sign out, send us a message on our email, which is africa@mta.tv, or our website is mta.tv, where you're going to watch many of our MTA programs and many or different channels. You can still have MTA on your phone, on your computer, through downloading an application on your Google Play Store. Just type in MTA International and you're going to have an MTA in your pocket. I remain Nambale Bashir, your host today. Till we meet next time, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.
You